So this is Dr. S.M. Goyal, MD Medicine, DM from top medical schools in Delhi, and also MD USA and DM USA. So one of the one of few thing healthy we need to do to keep our cholesterol on the low side. One is exercising, and then obviously healthy diet, and definitely not smoking really helps to keep the cholesterol level on the low side. But I will be honest with you, it's a very slow process. There is no question we should definitely modify our lifestyle to, as I mentioned above, and make it a habit. But at the same time, I will, as a doctor, most of physicians value the quality of life also. If you enjoy eating good food, and there are medicines available that can let us enjoy the good food and at the same time keep our cholesterol in the desired range on the lower side, then I will not mind, and you should also definitely have a discussion with your doctor. Again, this is my personal opinion, and I have come across several patients who did have a high blood pressure, but they did not enjoy food without taking any salt. So I made a deal with them. They can take little bit salt with their diet, but at the same time I will give them a HC water pill to get rid of extra salt and water. As a medicine doctor, as a kidney doctor, I became really expert in management. So one thing you have to understand that having a bad cholesterol on the high side, for years have no symptoms, and unless you have a blood testing done every year, you won't even know that your bad cholesterol is high. Just like I said, the recommendation, and guidelines may be vary, but I highly recommend, and it is recommended by top medical body to check all our blood tests, including cholesterol, at least once a year, especially in our countries like India and US. We do it anyway. All the doctors do it, and insurance pay for it. There are really two main kind of cholesterol. I told you total are three different kinds. Triglycerides are not very rarely very high. So what we focus on the HDL and LDL. HDL is called good cholesterol, which is high density lipoprotein, or H. So you can remember from H, high density lipoprotein should be high, and then bad cholesterol is LDL, or low density lipoprotein, and that is the sticky kind of a cholesterol, and it should be low. What good cholesterol does, it dissolves any stickiness and cleans our arteries, but unfortunately there is no medicine at this time. A lot of research is being done which will increase the HDL level. It only goes up by exercise. So, and you can understand why do we call LDL, low density lipoprotein, a bad cholesterol, because it is very sticky cholesterol. And why do we call HDL as a good cholesterol? Because it does it dissolves the sticky material in our blood vessels, open up our blood vessels. So when we have a high amount of bad cholesterol, or LDL, or low density lipoprotein, it goes to the tube and blood vessels everywhere, especially to the blood vessels of the heart, supplying food to the heart, and it sticks around all inside those heart blood vessels. So lumen of the heart blood vessel tube becomes smaller and smaller, and smoothness of the blood flow through the blood vessels is affected. So, there can be a plaque, or which can break up and clog the the heart artery and cut off the blood supply to a portion of the heart, or it can become, blood can become so slow that become clotted, and once again the blood flow to the portion of the heart is cut off and we have a heart attack. And the good cholesterol, the high density lipoprotein, and H, to remember it, H should be high, so it actually dissolves the sticky material. So all these studies have dramatically proved that HDL cleans and opens our blood tubes and arteries, and I have mentioned earlier that unfortunately a lot of research is being done, but there is no medicine available to increase our HDL. Only will go by exercise and good healthy habits. We do have a lot of medicines for LDL, and we should definitely consult our physicians if our LDL or low density lipoprotein or bad cholesterol is high.